Hello viewers, this is Dr. Muhammad Iftikhar Islam from Pakistan. Today I'm going to present my lecture on Giardiasis, which is also known as Giardia enteris, Lambiliasis, and beaver fever. Giardiasis is caused by Giardia intestinalis, a protozoal parasite. This organism is also called Giardia Lambelia intestinalis, and Giardia duodenalis. The organism isolated from humans, domesticated animals, and most wild animals appear to be identical. However, it is possible that Giardia intestinalis is actually a complex of several different species or subspecies. Van Leeuwenhoek, who is known as the father of microbiology, first observed a Giardia trophozoite obtained from his own stool in 1681. The pathogenicity of Giardia was doubted over the years. However, an outbreak in symptomatic travelers from the Soviet Union in the early 1970s increased awareness and recognition of the disease. The cysts can be transmitted directly between hosts or on fomites, including contaminated water and occasionally food. Among humans, anal intercourse is a means of spread. Ingested cysts release one or two trophozoites in the small intestine where the trophozoites multiply. Many of the dividing trophozoites are carried towards the colon and in cysts along the way. The cysts are infectious when they are excreted in the feces or shortly afterward. Trophozoites may also be found in feces, particularly in diarrheic feces. The incubation period in humans is 1 to 25 days. Most infections become clinically apparent after 7 to 10 days. Most human infections are asymptomatic, but some people develop mild to severe gastrointestinal signs. The usual presentation is a sudden onset of diarrhea with foul smelling stools. The feces may have a greasy appearance, but blood is rarely seen. The diarrhea can be accompanied by abdominal cramps, bloating, flatulence, nausea, and fatigue. Weight loss or dehydration can also occur. Giardia intestinalis can be found in many domestic and wild animals, including dogs, cats, and ruminants. Infections are infrequent in horses and pigs. Beavers may be a source of contamination in streams. In animals, the incubation period is usually 5 to 14 days. Most infections, particularly in adult animals, are asymptomatic. Acute, chronic, or intermittent diarrhea may be seen in some puppies and kittens. The clinical signs can include diarrhea or soft stools, a poor haircut, flatulence, and weight loss or failure to gain weight. The stools are typically light colored and mucoid and may contain undigested fat. Blood is rarely seen. Similar enteric signs have also been reported in other species, including cows and lambs. Well, no gross lesions are usually found during the post-mortem examination of the infected animals. Giardiasis is usually diagnosed by microscopic examination of the feces using either stained preparations or unstained wet mounts. Either cysts or trophozoites may be found. Infections may be self-limiting but the potential for zoonotic transmission should be taken into consideration. Fenbendazole, albendazole, metronidazole, tinidazole, quinacrine, and furazolidone have been used in dogs or cats. Cleaning and prompt removal of the feces can limit the environmental contamination. Herd surfaces can be disinfected and should be left to dry, as the cysts are susceptible to desiccation. Pets and livestock can be infected from unsafe water sources such as lakes, streams, springs, and shallow wells. Keeping pets indoors can decrease the risk of infection. Vaccines available for dogs and cats can prevent infections and the shedding of cysts, but their use is controversial. Good hygiene, such as hand washing, can help prevent the infection. It also prevents spreading the giardiasis to the other people. People with giardiasis should not swim in the recreational water for at least 2 weeks after the symptoms end. Fecal exposure should be avoided during the sexual activity. Well, that's the end of our today's lecture. Thank you so much.